Today we're going to be talking about an adventure, and that adventure is cosmetic surgery under local anesthesia. Hi guys.
Hi Michelle, how are you today?
I'm doing really good. So this is really something that I think people are going to be very curious about, this topic.
We sure hope so. Hi
I
Karina,
hope so.
how are
Hi.
you? And who better to have than Karina, our surgical liaison.
Exactly.
So right today we want to talk about the surgical adventure, and I've kind of dubbed it when Michelle contacts me, what are we going to talk about this week, as cosmetic surgery under tumescent local anesthesia, which sounds kind of foreign to a lot of people.
That's a fancy word, tumescent.
Tumescent local anesthesia, right. And, what is the whole process? So I thought maybe we would jump right into it. I've already introduced you, Karina, as our surgical liaison. So Karina, tell me where do we start with, if somebody's interested maybe in chatting with us about maybe cosmetic SmartLipo laser liposuction, maybe breast augmentation, breast lifts, breast reductions, facial fat grafting. What is the first step?
First step is to call our office.
Okay.
I'm not always available right away, but they can always talk to the front office
Sure.
ladies and schedule a time to talk to me and further investigate what it is, what are we looking for, all that good stuff.
So when they call, do they actually do they speak with Paris or Lauren, or what happens?
Yeah, sometimes they get me. Sometimes I pick
Okay,
up the phone.
and if
I'm
they
a
don't get you, what
proceeding. If they
happens?
don't get me, then they'll talk to Paris or Lauren, and they'll say I have some surgical questions, or they'll start asking questions, and they'll set them up with a phone consult time that works for them and myself.
Okay, so that's key. Is that they're going to set the patient up with an actual phone consultation time.
Correct.
I think one of the most discouraging things for any of us as a consumer, maybe calling about our car or whatever it might be, is sort of playing phone tag with people.
Right.
So we've learned that their time, our patient's time, your time is very important, as is all of ours, and so we set up an actual consultation time with you by phone. So let's say now you connect, okay, you connected with the patient. What usually goes on during that conversation?
Yeah, so usually, some patients know exactly what they're calling for, and some patients I don't really know what I need. So it takes a
Right.
little bit of investigating,
Okay.
a few questions, and then we go from there. We can review pricing, we can review, pretty much any question that they have. But at this point, the most important thing is evaluating if the patient is ready for a consultation with you, a formal consultation.
A formal consultation.
Sometimes they may call and they just want pricing.
Okay.
What does it cost? And then they say, okay, I'll call you back, and so that kind of thing. So it's just evaluating: do we need a formal, or are we just curious? Are we learning?
Okay, so interesting that there are some people who call and their first question is pricing, and certainly we understand that. We're going through some tough economic times right now, and of course it's, the price of eggs is very important to all of us, right? So that's important. One caveat to that, and when we look at our pricing at Dr. Tom Cosmetic Surgery, I try to be very competitive, okay? We're not the discount place. I don't want to go for my surgery to the discount place. I want to go somewhere where I know they take pride in what they do, they're really good at it, they're accredited and so forth, so that's important. But we do price ourselves to be competitive, okay? And so pricing isn't the whole thing. What I really liked about your answer, Karina, is that you mentioned that you're listening to their questions, okay?
Right.
And I remember, I'm going to say it, the late Dr. Lucas. Dr. Lucas was my chief. He was the chief of surgery when I was in training as a general vascular surgeon back in Detroit, Michigan. And I remember him saying in his low voice, Walter, he'd say, you gotta listen to the patient. If you listen to the patient, you can make the diagnosis without even examining them. And I remember him saying that to me, at how important that is. And so thank you, Karina, for carrying sort of Dr. Lucas's legacy, is we need to listen to the patient. So you're listening to the patients, and sometimes they just have questions.
Right.
And it takes a lot of courage for them to get on the phone to talk to you, let alone come into the office. And sometimes they call and we may not hear from for 2 years, 3 years.
Right.
And then we get a call and, I spoke to, Patty, who was our practice administrator some 15 years ago, right? And yet they call us back because they were treated well. We listened to them. We answered their questions. And so that, I thank you for that, Karina. So, you're initially speaking to them, and then sometimes they know that they want a consultation. They're serious. They've been thinking about it for 8 years and they want the consultation yesterday, right?
Right.
That's usually the way that it is. Okay, so we set them up for, how do we set them up now for the consultation if they decided, I want to do something?
Yeah, so our most common way is virtually. We are doing some in-office consults now. It is helpful. So whichever, I usually ask, what's your preference? Virtual gives a little bit of flexibility. You can do it in your car, you can do it on your lunch, you can
Right,
do it,
okay.
you know, instead of
Right.
sitting in traffic, you could sit in your car after work and do your consult. So that kind of thing. So whatever works best for the patient, we'll set you up with a consult with Dr. Tom. And we will ask for photos. It's very important. Photos help Dr. Tom determine, you know, what is the plan, what are we looking at.
Right.
And we'll send, you know, the patient paperwork to their email, all of that good stuff. So
Yeah, it's interesting, Karina, that we moved, and I've mentioned this before on the show, we moved to virtual consultations because of COVID. And initially I didn't like it because I wanted to make that one-on-one connection in person. Yet I would say 90% plus of the patients really liked that because it fit in with their schedule,
Right.
their work schedule, running around picking up the kids, their home schedule, whatever it is, or even their travel schedule. We've done consultations with the patients in Mexico and in Europe and so forth, and it makes us more readily available for them. One thing that you mentioned, Karina, I think it's important, is that we ask for photos ahead of time.
Right.
And that helps me to prepare what we want to discuss for the patient, set up a lot of before and after photos because everyone is customized in terms of our consultation. And also it kind of tells me how much the patient is willing to be part of the team, okay? I mentioned many times, in fact, we even have an ad, you know, for marketing, but it's not because marketing should be truthful. It is truthful, is that the patient is part of the team.
Right.
And so when you take the time as a patient to document what we need to be looking at and give us a helping hand to give you what you want, the result you want, that's really huge. And that's a real good indicator to me that we're going to be compatible working together.
Right.
Because the patient is an important part of the team. And Michelle, you have a question.
I do have a question. So, Karina, when you're talking with someone and saying, okay, you need to send in some pictures, do you guide them or give them sort of like, it has to be from this angle? Because, of course, we all want to look our best, right?
Yes.
But that might, you need to have like maybe a full front face, not from a higher
Yes.
angle kind of a thing, to help people give you, you know,
What we were looking for.
good
Yeah.
images, right?
Yeah. So I do guide the patient, depending, you know, if it's the breast or the body or the face. I actually have some examples that I attach from our website, and I just say, this is, you know, if you're looking, but I do say front, left, and right side, and I tell them verbally. And then on an occasion, I'll get like a really close up, and I go, that's not gonna work. Could you please send further?
Right.
Which is fine. And sometimes it's hard if you're alone or you don't have anybody to take them. I've guided someone through taking a picture with a self timer. So if they call me and I'm like, stay on the phone with me, I'll walk you through it. So.
See, and I love that. So thank you again, because here you are. That's the personal care and attention that a patient deserves,
Right.
and what we try to deliver on. So you're on there, and so a couple of the keys, so we put them on selfie mode, right?
Yes.
And I think Michelle brought up a good point. If you're contacting me because your eyelids you feel like you have heavy eyelids, don't take photos and try to open up your eyes as wide as they can. Let me see what they look like. I've had a couple of patients do that, and then I see them on Zoom or in person, and that's, where was this picture from?
Yes.
And I said, well, I wanted you to see me at my best. And I said, no, actually, we want you to see you at your worst, because that's your concern, right?
Yeah.
Okay, so you put them on selfie mode, and you use a timer, you say?
You could use a timer on most phones, and you
Okay.
can prop up your phone. You got to get creative.
Okay.
Yeah, prop it up
Okay.
against anything, but
Okay.
yes.
All right, so that's important. So we put on timer, and they send in the photos. Even if you're coming in for a live in-person consultation, this helps us to prepare so that we can make your consultation efficient for you, okay? We set up a lot of time. We set up an hour with me, an actual hour where we go over everything, and so we spend a lot of time. So you're on the phone for anywhere from, 15 to 30 minutes with the patient initially?
30 minutes.
30 minutes at
maybe
least.
45,
45,
depending.
okay, all right. And then they get an hour with me, okay? And then let's say that whatever the procedure they want, and we've described it to them and gone gone over all of the benefits of it, the alternatives, what are potential risks, of course, costs. You're going to review that with them, costs in our scheduling. And let's say they now schedule it and they want to have that procedure. What's the next step for that patient?
The next step is our pre-operative visit. So that is the visit before surgery, before your actual scheduled surgery. So now you've scheduled your procedure, we've collected your deposit, all of that good stuff, and now we'll see you. If you've already seen us in person, great, but if not, then that's when we'll see you in person.
Okay.
And it's usually about a month before surgery,
Right.
to give you time, and at that point we'll review all of what to do before and after surgery, how to take care of yourself, how to set yourself up for success, all those good things.
Right. So when we, if I can summarize that for our listeners, so if we've done a virtual consultation and I've not actually had a chance to really meet you one-on-one live and examine you, what we'll do is we'll set you up for your pre-op. Now you decided we want to go ahead with surgery. Obviously, you just don't show up on the day of surgery and I've not actually met you. What we do is we set up a pre-op visit, and that's really important. So come with the idea that you're coming for further education to get the best result for you, okay? Don't make this a nuisance visit, because we, again, set aside another hour for you. And so, Karina, you spend about half an hour with them, right? And what you're doing is going over the directions.
Correct.
Directions, who they need to have there, all of the important things that are very important for your best result, okay? And then I spend about a half hour, sometimes 45 minutes with the patient, the patient, as well, in terms of pre-oping, not only examining you, kind of re-reviewing, because who remembers everything
Right.
with just one meeting? I
Yes.
don't. So, we re-review everything with you, and then we prepare you. So now we're set. Okay,
Yes.
the patient's been listening,
Yep.
we've been listening,
Yes.
we've gone over things, and they've been really good. They've gotten their labs done, they've picked up their medications, they've stopped the medications that tend to make you bleed ahead of time, like aspirin and some homeopathics, fish oil, and so forth.
Right.
So they stop all of that ahead of time. Everybody's behaving themselves. We're all being good citizens. Okay, now what happens on the day of the surgery?
Yeah, so a day of surgery, depending, sometimes we have an evening surgery, so we'll do, but
We
most
do.
surgeries
Okay.
start at 8 a.m. sharp for the
Okay.
patient.
For the patient. Okay.
Our team gets there around 7:30 to help
Okay.
set up everything. The nurse and Brady, our other medical assistant, scrub tech, and myself, to make sure that everything is, everything's prepped and our equipment is ready to go for the patient. When the patient arrives specifically, they're greeted either by myself or the nurse.
Okay.
In case she's still doing stuff in the back, I'll bring them back and let them use the restroom, let them get settled. I usually make sure that they have all their meds with them, they didn't forget anything, get their rights information, all of that fun stuff. So yeah, it's about an hour before we even go into surgery.
And,
It's a lot of prep time
It's a lot of prep time,
Yes.
right? So even if we do an operation that's only taking a couple of hours, you're probably with us for about 3.5 hours there, okay? And so, for all of us who are running around, I call it our ADD society. No, I only have time for this, and I'm scheduled this, and I'm scheduled at 3:30, but I'm supposed to be in Ukiah at 2 minutes later. Those kind of ways that we behave nowadays is that we want to make sure that we're well prepared. So you mentioned that the team comes in at least a half hour ahead of time, maybe 45 minutes. They're not only preparing medications, the local anesthesia, which I order and we double check and make sure that everything is appropriate, checking all of our safety equipment so that we are able to deliver safe surgical care for our patients, getting them ready. The patient comes in, we actually want to review their medications with them
Right.
beforehand. We inform them that their driver needs to pick them up. And for those of you who know that the only way that I do surgery, cosmetic surgery at Dr. Tom Cosmetic Surgery, is under local anesthesia. So in other words, we inject very slowly local anesthesia, and we can do amazing things with this technique.
Right.
Takes a little bit longer because we have to just go slow. We have to be more gentle with the tissues, which I think is a real positive for the patients, but it does take a little bit longer. And so we really want to have the patients prepared, both educated as well as emotionally ready to have the procedure done under local anesthesia. So they come in and the team is ready and we're preparing them, and we then bring them into the operating room. And so I'm going to run with this part of the show a little bit in terms of just describing the procedure. So at this point, Karina and Bridie, who's our other surgical assistant and tech, they have prepared all of the equipment and so forth for the procedure itself. The nurse who brings our patient into the operating room and preps the patient, and then having the patient on the surgical table, which actually is a very nice massage table, so it's really cool. So you're actually lying on a really super ultra deluxe massage-like table. I will come in, we do our timeouts. We do actually 3 timeouts where we ask you to identify yourself, what is the procedure that we're doing, on what site, do you have anything changed in your medical history, do you have any medical allergies? We do that 3 times, believe it or not. Can you tell I'm a little OCD, Karina? Okay, so I always say that you want your surgeon and your pilot to be OCD. You don't want to be married to them because they're a pain in the butt, okay? But you want your surgeon and your pilot to be OCD. So we do 3 timeouts throughout that preoperative time that they're with us, and then we begin the procedure. And so as we do the procedure, when I'm freezing up the skin and then administering the local anesthesia in the area that we're going to operate on, our nurses, who are all highly trained, who work at the hospital as well, they actually are monitoring the patient, and while they're monitoring the patient, they're giving the patient a head massage, and the patients love it because here I am, I'm administering the local anesthesia. You and Bridie, as our surgical techs, are getting all our equipment ready, and the nurse is monitoring the patient but giving them a head massage, and all that's part of the distraction of making the administration of the local anesthesia, in my opinion, very, very tolerable, if not painless, very, very tolerable, with a few little pinprick here or there, but most people tolerate it well. Okay, so that takes time though, right,
Yes,
Karina?
yes.
So if, for instance, we're doing SmartLipo or laser liposuction, we're doing the abdomen, that may take me a good half hour to put the local anesthesia in the abdominal area. If we're doing breast cosmetic surgery, it might take me 20 minutes or so in an area that we're working on to administer the local. So you can see that this is a slow process. And it's something that I learned actually from my experience, and I've always enjoyed new technology and being innovative, Karina. But my partner at the time, Dr. Schmidt, and I, we were the first surgeons in the North Bay area to introduce laparoscopic gallbladder removal. And I remember that first procedure taking us hours and hours to do it. Okay, and of course it was the first time being done with equipment that isn't as advanced as we have now. And I remember Dr. Schmidt and I looking at each other and saying, oh my gosh, is this the way that we're going to be doing this procedure? Because we could have been done in 45 minutes in our traditional naked incision and do the operation. Okay. And what was very illuminating to me was the next day when we went to see the patient, we discharged her home. Okay, so here it took us longer to do the procedure, but wow, the recovery, she went home the next day. Now people are going home the same day of this operation sometimes, where with the traditional method, they were in the hospital for 5 to 7 days. So doing the procedure, taking our time, which was less invasive on the patient, even though it took longer for us as the surgeon, was way better for the patient. So that's the way that I like to look at doing procedures under local anesthesia. So that means that you, Bridie, and I have to have really strong bladders, right? Because it takes us longer to do the operation, but it's a great technique. It's called tumescent, Tumescent anesthesia, local tumescent anesthesia, and it has really, in my opinion, revolutionized what we can do for cosmetic surgery, and so patients love it. We even get people, I remember people from out state, although we now have an office in Hawaii, we used to have people come in from Hawaii to have the procedure done with us who've looked up specifically, I want my procedure under local. I remember a young lady from St. Louis who came in to see us, another young lady from Texas. So, they're traveling because they understand that the benefits of doing procedures under local anesthesia far outweigh the more traditional ways of general anesthesia. So that's great. Yes?
Can I ask about, so and I'm sure that you're going to cover this next, but I'm just wondering about sort of like how long this anesthesia lasts and what
Right.
sort of pain you can anticipate as you're coming off of
Okay,
that.
perfect. Okay, so let's just talk about general anesthesia first. So, you're asleep, you have a procedure done, and you wake up, and all of a sudden it's, whoa, I'm hurting. So you have to have a lot of narcotics and so forth on board. We don't administer any narcotics for any of our operations, okay? Now, we might write for some Vicodin, Norco, that's hydrocodone or oxycodone for afterwards, but we do not administer any narcotic during these procedures, okay? So the local anesthesia, thank you, Michelle, it's a great question. The local anesthesia that we use is lidocaine, and it actually is absorbed by fat. So especially for liposuction cases, absorbed in the operative area, and it helps it to extend its length and so of effectiveness. So for SmartLipo, patients go home, usually they don't have any discomfort at all, and they may be pain-free for 3 or 4 more hours once they get home. And that's where we ask them to take pain medication to have it on board when the local anesthesia wears off. Now, in the eye area, it works very effectively when we do eyelid surgery. For facial fat grafting, it's very effective, probably a couple of hours afterwards. Probably the area where it does wear off a little bit sooner, and I'm going to say an hour or so, is in the breast area, where if we're dealing with the muscle, and we're putting an implant under the muscle, that wears off a little bit sooner, because the muscle is muscle, it's not fat, and so the effect doesn't last as long, but you're feeling great when you leave the office. For most people, everyone's different with the local anesthesia technique. So thank you for asking for that. So it works really well. So Karina, get you back in here on this discussion. So now the procedure has been completed, and we call the patient's driver, and then at that point we usually send someone out, and that someone is usually you.
Yes.
So what happens? What do you do with the driver when we're completed the procedure?
So we let the driver know how to take care of our patient, because they're going to be the ones that's staying, or sometimes they have them and someone else, but it's really important who you choose for your aftercare, because they'll be making sure that you're getting fed properly, that you're getting all your medications on board that need to help you with your discomfort, and just be your little nurse at home. So you definitely need someone you trust, someone who will take good care of you. Sometimes the patient opts to have just someone sign as a driver, so we don't really go over the instructions. We give them written instructions, and then they go home. I do recommend having whoever you're having take care of you come in, because then they can ask their questions.
And please spend some time, and that's, I know we will get patients to say, well, I can't find anybody, or someone can't do that, or they tell us they have someone and they don't, and that's like a huge no-no, because you really want someone there to take good care of you. Okay, we have a tremendous safety record with this treatment, but with this type of technique of anesthesia and surgery, but we really don't want any surprises. We want you to recover and to do well. So we walk the patient. Most patients, we walk them out of the, 90% of the patients we actually walk out of the office.
Of course.
I walk out with them. I got them by the belt, and we joke about it and say it's the Dr. Tom wedgie maneuver. That way nobody falls, because nobody wants to get a wedgie, and I've got them really tight, and we walk them out to their driver, and they head home. And so part of the follow-up, and I know at hospitals a lot of time they'll have somebody call the patient. It's been my protocol for years now, decades actually, but I actually will call the patient, I will call you on the evening of the procedure, the surgery itself. I will then actually call you the next morning, so post-op day number 1, and then on post-op day number 2, I will call you, and usually we'll have you come in for immediate post-op visit. If it's breast-related cosmetic surgery, usually in a day or 2, or eyelid surgery, maybe liposuctions a couple of weeks out, vein surgery a couple of weeks out. But you have direct access to me. You have my cell phone number, so that you know that you're going to be well cared for and followed as well. So, Karina, now we're getting to the point here. We got about an hour, about a minute and a half left. So now the patients have gotten through that post-operative period, and they're coming in for their, let's say, their 2-week check. What usually occurs at that point in time?
So if there's tapes, we usually get those out of the way, get those removed.
I'm sorry, if they have what?
If they have tapes in their incisions.
If they have steri strips, okay, their incision tapes, okay.
If there's steri strips or butterfly tapes. And then further education on how to keep taking care of themselves. If they have restrictions, we can talk about that. What any final questions. Most of the time they're 1 to 2 day visit. They're pretty out of it still, even though they're there. They're in discomfort, or so we like to remind you again 2 weeks when you're a little bit more clear, you're not in discomfort,
Right.
how to continue your long-term care for yourself.
Right. So I think that's great, and I want to thank you because you're a big part of that education, which is huge for us. And I will just say that I just had a young lady. I think she was in her 20s, and we did a breast lift on her, and she did great. And I was mentioning to her, and she was in with her mom, and we were chatting, and I was remarking that I was driving in thinking, occasionally we get those patients, I think, wow, they did just super. They did great. And I started laughing to myself because actually, you know what they did? It's a trick question. You know what they did?
Yeah.
Yeah? Okay. They listened. They followed the directions. And they started laughing because they said that's what they did. They followed the directions. So we'll all listen and we'll all follow directions. I want to thank everybody again for listening to us, and turn it back over to Michelle.
Right on. So much great knowledge, and again, listening is key on both sides. So I'm glad that you emphasize that, Dr. Tom. It's very important. And advocating for yourself in your healthcare, that's also very important. You can reach out to Dr. Walter Tom of Dr. Tom Cosmetic Surgery. He has offices in Santa Rosa, Napa, and Maui. Also find him online at drtomcosmetic.com. Especially if you're looking for something under local anesthetic, reach out to Dr. Tom. You can call 707-542-8346. We'll see you next time on KSRO.